Hello, hello, hello. Good afternoon, everybody. My name is Drew Shockley, and I'm here with Move Health for today's session, Early Retirement Healthcare Coverage for Pre-65 Retirees. We are pumped and excited to have you all joining us today, and we are going to give just a couple of extra minutes here so that everybody that's planning to be here can join. But we're super excited. If you were coming to watch today's webinar, it is a live webinar, by the way. So there will be different ways for you to interact with us, and we'll go through that in just a second. There will be a presentation that I will be using, but I am happy to deviate from that and answer any questions that we might have live. With me today is my good friend and our Director of Marketing, Josie Living Good. Everybody say hello, Josie Living Good. Can't hear you, right? But if you did, that's great. So Josie is actually going to be in the chat, and if you are familiar with Zoom, you're able to type here and give some feedback to us, ask questions, make comments, whatever it is. We'd love to know. Josie already put it in there. I would love to know where you are joining us from today. I'm going to put mine out there. I'm joining from Evansville, Indiana. It's a small Midwestern town in the southern part of Indiana. It's called Evansville, and I've been here for about 20 years. I came to college here and ended up staying. We have Kelly is joining from Mexico. Welcome. Kelly Cox is joining from Smithville, Missouri. We have another one from Branson, Missouri. Lots of Missouri. My wife is from Missouri. She's from Poplar Bluff, Missouri. There's a Birmingham, Alabama. Welcome, David, from Birmingham. Noblesville, David, fellow Indiana, fellow Hoosier. Conrad, I see you out there in Seattle. Michael, thanks for joining from Ocala, Florida. I'm sure it's nice and sunny there. Richmond, Virginia. Welcome, Nicole. Glad that you're here. Glad that you're here. We appreciate that. It's always nice to know where people are joining from, who's joining, where they are. And so we love doing that. I'll go ahead and share my screen, and just so that you are able to see what I'm going to be working from today. So that'll give you some viewpoints and some talking points. So give me just a second. I'll get that going live, and then once again, you're going to have the opportunity to interact with us. You're going to be working with us, and you can comment in the chat section. There will be a Q&A session at the end as well. So there is a different Q&A box or response, area than there is for the standard chat. So if you're out there, you'll notice there is a Q&A box. If you're familiar with Zoom, go to your panel, whether it's at the top or the bottom, wherever that might be, and you can open up the Q&A box. If you want to do that, it kind of helps Josie and I organize the questions that we have or that we might have, but you can also just throw them in the chat, so we're totally okay with that. I've got that over here. I'm viewing that, and I've got the presentation going here. So again, welcome everybody. Today is a live event, so we encourage you to to work with us, chat with us, and use the chat or Q&A. But we're going to dive into early retirement healthcare coverage for pre-65 retirees. If you don't know anything about us, let me tell you about Move Health. So Move Health is a combination of our founding team had over 100 years of experience in the healthcare sector. And this allowed us to kind of build, the Move Health platform, which is a SOC 2 Type 2 platform that works with financial advisors and clients of financial advisors to give pre-65 health insurance guidance and Medicare. So we're not going to be talking much about Medicare today, but Medicare is an area that we consider ourselves experts. So if you are approaching Medicare, you have a spouse that's approaching Medicare, we handle that as well. In addition to health insurance and health insurance before Medicare, we do dental and vision and accident and critical illness and all kinds of other supplemental type products that work alongside of your healthcare coverage. We're super proud of this, and Josie was a big part of this. We are a award-winning platform, and we've been featured in a number of publications you can see over there to the right. But the Move Health platform was built specifically for this situation where financial advisors have clients that are wanting to retire and they need assistance moving into the next phase of life. So if you don't remember anything else today, we're here to help you move into that next phase of life and what you're doing. So I'm a real person. I'm not AI. This is my family. I have a real family. This is my wife and our two boys, Mason and Max. Actually, Josie, we need to update this slide because my youngest turned 15 last week. So he's now 15. And then my oldest will turn 17 on September 11th. So they're getting bigger. They're getting older, as all of you that have kids know. I started working in the healthcare insurance industry in 2005. And I got a job working for a carrier, Anthem Blue Cross Blue Shield. And since then, I've been a founder of 3 successful healthcare startups, over the past 20 years. So I love this industry. I love serving clients and working with people and helping them kind of, navigate healthcare in this country. And, if I'm not doing that, I'm typically at a soccer game. I'll be going to a soccer game today at 5:30, or we love going to the lake or playing golf, and that's kind of what we do. But you didn't come here to learn about me. You came here to learn about pre-65 health insurance options. And so if you're a note taker, this is the time where you grab your pen, grab your pencil, grab your notepad. This is where we're going to be walking through some things and teaching you all. Okay, so how do we know, how are we going to learn about the health insurance options before Medicare, before 65, or how do we learn? We need to understand how people buy healthcare coverage in the United States. So here's some facts for you. 50% of the population have group health insurance coverage through their employer, okay? Maybe many of you are in that situation now. You're working, you have healthcare coverage through your job, or your spouse is working, you have healthcare coverage through your job. That's what 50% of the population does, okay? Generally, if you're an active employee or a spouse, or maybe you even have healthcare coverage from a company you retired from, this encompasses 50% of the population, okay? 20% of the population are covered by Medicaid. Medicaid is different from Medicare. Medicaid is state low-income programs, typically for children or kids, that have certain incomes or below certain thresholds, and then sometimes for adults and or pregnant females may qualify for state Medicaid programs, okay? So this is 50% on their job, 20% on state Medicaid programs. We've already knocked out 70% of the population in one slide, okay? Next, 15%, 15%, are enrolled in the Medicare program. This is the one that we pay for. Okay, so this is the one that we pay for. This is generally, to be on Medicare, you need to be 65 or older. You have to have paid into the program. This is the one, again, that we pay for. You can be on Medicare earlier than 65 if you've been disabled, but generally most people qualify at 65. What we do at Move, we help people find Medicare supplement plans, prescription drug plans, Medicare Advantage plans. We're working with clients every single day that are aging into the Medicare program, but that may not be you. 8% of the population has no coverage today. Hopefully that's not you. Hopefully you don't go without insurance. But if you do, and you would be in this category, you would be in a category of about 8% of the population that have no coverage. Okay, so we're at 50% have coverage through their job, 20% is Medicaid, 15% Medicare, and then 8% of people have no coverage. What's left? Well, the individual market is what's left. So that's approximately 7% of the population actually buys their own healthcare coverage. These could be people that are self-employed, or they work at a small company or small business. Maybe they're a student, gig worker, part-time, 1099, or my favorite topic is early retirees, people that are in this window. So if this is you, great. You're a part of the 7% of the population, or the 25 million people that end up buying their own insurance. Okay? So now that we got some fun facts out of the way, let's talk about what are your options. Generally, if you want to quit your job today and move into your own individual healthcare plan, what do I do? If I'm not eligible for Medicare, what do I do? Well, generally, one of the first options that we discuss with a client would be COBRA. COBRA, you've probably heard of it. Generally, sometimes people think that COBRA is an insurance company. COBRA is very much not an insurance company. COBRA is a law, and it stands for the Consolidated Omnibus Budget Reconciliation Act of 1985. Okay, so COBRA has been around for a long, long time, but it's a law, and it requires employers to offer an extension of healthcare coverage that you had through your job for a period of time. Okay, this might be a good thing for you. Generally, if you've already kind of met part of your deductible, or if you've been working and you've had some expenses that have went to that, it might be nice if you're retiring in the middle of the year. You wouldn't have any change from an employer plan, and you're pretty familiar with it. However, Cobra generally is one of the most expensive options. Typically, it only lasts 18 months. There are some scenarios where it might last a little bit more. And, Cobra is not credible coverage for Medicare, which is kind of an interesting thing. And, this kind of leaves it today in 2026. Cobra is not used as often as it was back in the day. Back in the 80s and 90s, when it was harder to buy an individual plan, or even the early 2000s, it was harder to buy individual health insurance coverage. And so Cobra was a law that made a lot of sense. And in 1985, if you were leaving an employer plan and you were sick or hurt or had a condition, you may not be able to buy an individual plan. And that's not really the case anymore. So Cobra, it's an option, but it's not one that we recognize as being used by the majority of people. It's definitely a small minority, and it's not used as often as it used to be. So that's Cobra. Next option, if you're quitting your job, moving into the next phase of life, you can enroll in a short-term medical plan. Okay, short-term medical plans are what they are called, short-term. Generally, depending upon the state that you live in, you may be only eligible to get coverage for 2 or 3 months, maybe 3 months. You also could, depend upon the state you live in, you could get it for longer durations, maybe up to 6 or 9 months. This is a good option generally for people who are healthy and really truly who just need coverage for a short period of time. This is generally you could get large networks. So most of the time, short-term medical plans have PPO networks. They're typically a lot less than what you would get for like a fully baked Affordable Care Act compliant plan, and you can buy a short-term medical plan at any time. So, some of the problems, most of them are not ACA compliant. Most all of them never cover pre-existing conditions or pregnancy or prescriptions, stuff like that. Most of them you have to go through some level of underwriting, and depending upon the state you live in, it could only be limited to to a period of time. So when you look at the market, 25 million people, less than 1 million people are enrolled in short-term medical plans. It's not as widely used. Now, this is used by more people, healthcare sharing programs. So this is a non-insurance alternative, typically faith-based sharing programs that are being used by several million Americans right now in the individual market. Great thing about it is healthcare sharing programs are usually half the cost of what you would find for like an Affordable Care Act marketplace plan. Generally, they have large networks or even sometimes no networks. And you can enroll in a healthcare sharing program really at any time. There's no special enrollment period or, period of time or definitive thing that you have to do. However, most of these healthcare sharing programs, they're not they may be, they may have some of the parameters of an ACA plan, but they're not an ACA plan. Generally, you don't have any guarantees. Most of the time, there's some smaller programs that, you may run into, some issues. If they're really, really small, you got to be super careful. And that's some of the cons that you would run into with healthcare sharing programs. Okay. Last but not least, we get into the largest percentage of people, which is over 92% of the individual market are enrolled in Affordable Care Act compliant plans. Okay, so this is what most people do. If you quit your job, you move into the individual market, you're buying a marketplace plan or an ACA plan, or sometimes widely known as Obamacare plans. There's over 23 million people that are enrolled in Affordable Care Act plans. The number one reason, because they cover pre-existing conditions. They're required to do so. Rates are only based on your age, where you live, and your tobacco status. Nobody can be turned down for Affordable Care Act plans. It's guaranteed enrollment. And there's a large healthcare premium tax credit or a subsidy that can make this the most affordable option for many, many people. It allows people to kind of take advantage of this through managing their modified adjusted gross income, or you working with a financial advisor to pre-plan for these things. And Affordable Care Act plans, are widely used by over 92% of people in the market. What are some of the issues with them? Well, sometimes, depending upon where you live, the network could be restrictive. It might be an HMO plan, or it could be, an HMO POS, or it could be an EPO plan, which is kind of where some other types of networks from like your regular PPO. It requires some extra legwork sometimes, during tax time, especially if you're using subsidies. And then maybe compared to, what you would have seen through, an employer plan, it might have a higher deductible or out of pocket. Sometimes, not always, but sometimes it might have a higher deductible and out of pocket. So I'm going to dive into Affordable Care Act plans just a little bit more. They're all guaranteed issue. So this all started in 2010 with the passage of the Affordable Care Act. That was under the Obama administration. They passed the bill in March 23rd, 2010, and then it implemented these rules in waves, with the largest one of the waves being in 2014 when the marketplace started. You cannot be denied health insurance anymore. I'll go back. This is why COBRA is not as widely used as it used to be, because now you can buy an individual plan and it's guaranteed to cover your pre-existing conditions. The cost, it's only based by a few things. It's based on where you live, basically state, not necessarily like, do you live on the east side or the west side? It's like, it's based on where you live, mainly state, and then it's also based on your age, and then it's based on tobacco usage. So, when we're talking about Affordable Care Act compliant plans, we're not talking about government health insurance. We're talking about plans through all of the major insurance carriers, Blue Cross Blue Shield, United Healthcare, Ambetter. All of these companies offer Affordable Care Act compliant plans in the individual market, and all of them are carriers that we work with. So, key learning number one: how do people buy health insurance? What are our options? COBRA, short-term healthcare sharing, and Affordable Care Act. This is key point and key learning number one. Okay, deep breath. Hopefully you're still with me. Josie, hopefully everybody's still with me. Please remind everybody, if you want to make any comments, questions, feel free to put them in the chat here. We're monitoring that. If you have any questions about anything we're saying, we're more than willing to answer. So let's move on. Key point number two. How do advanced premium tax credits work? What are they? And how can you take advantage of them? So let's talk about that for a bit. What are advanced premium tax credits? Well, the purpose of advanced premium tax credits is to make healthcare coverage more affordable. So it's money from the government applied to specific individuals and families that help pay for their healthcare cost. They're advanced, which means you get them in advance. You get them on a monthly basis, and then they're reconciled when you file your taxes in a future year. Okay, so what are the healthcare premium tax credits? They're for the individual market, depend upon your income. They're advanced. They pay for your healthcare coverage in advance, and there's something that if you don't know anything about them, you're going to know more when we get done. So why do they exist? Well, before the Affordable Care Act, some people would say healthcare coverage wasn't affordable. It actually was less than what it is today, but some people would say that. And so the advanced premium credits were designed to really offset the cost of marketplace plans. From 2013 to 2014, the cost of individual plans went way up. But after the advanced premium tax credits, it makes it more affordable for many people. Getting more people into the program, into the marketplace, helps to kind of balance the pool. We wanted to reduce the number of uninsured. I think everybody wanted to do that, regardless of what side of the aisle you were on. And they're all funded through through the tax system, so we're all paying for it. It's just dependent upon whether you are using the tax credits or not. So how do they work? Well, first of all, you can't have coverage through a job. You can't have coverage through Medicare. You can't have coverage through Medicaid. So you have to be in the individual market. And if you are, then you estimate your household's modified adjusted gross income. You go to the marketplace with our assistance. We help you sign up for a plan. The federal government, through the advanced premium tax credit, pays the difference in the cost of your plan immediately. The credit is applied to your plan, and then you reconcile when you file your federal tax return. It's pretty simple. It's pretty straightforward, but not everybody's eligible, because you have you can't be working. You can't have coverage through a job. You could be retired. You could be an early retiree. You could lose your employer coverage, and you could enroll in the marketplace. You got to have an income between a certain window. Okay, so we're going to talk about that, and there's a little acronym up there called the FPL. It stands for Federal Poverty Level. So you're sitting there right now and you're thinking, okay, well, what's the federal poverty level? There's no way, I have this, and this. It's nothing to do with assets, nothing to do with real estate, home values, anything like that. It's all due to the modified adjusted gross income that you create, or your financial advisor creates, in that early retirement window. Okay. So how long have tax credits been around? Let's take a look. They started in 2014. So we're literally in like our 12th or 13th year doing advanced premium tax credits. There's been a lot of changes. There have been administrative changes. New president came in, Trump came in. Nothing happened with the advanced premium tax credits. They've been a staple through 3 different administrations. Some of the administrations have treated them a little bit differently. One of the most interesting things that happened is that in 2021, in the American Rescue Plan Act, the Biden administration actually removed the top limit of income. So you could have a much higher income and get subsidies from the government. This was a kind of a big deal. So we had people, no longer did you have to kind of control your income back in 2021, and this went on for 5 years. At the end of 2025, we actually moved back to the original income cliff and income chart that was created by the Obama administration. Okay, so we're back in to the to the regular income. So I'm going to show you that income chart here. Left side is your household size. All the way on the far right is the limit or the cap, and this is the limit or the cap for tax credit eligibility today. For the last 5 years, you were able to make above and beyond this limit, and if you did, you could still get a tax credit. But now you can no longer do that. We're back to the original in 2026. We're back to the original goal. So if you're single, that would be a $62,600 modified adjusted gross income. If you're a household of two, it would be $84,600 in modified adjusted gross income. Household of three, household of four, you see the numbers go up. When you go down the chart, okay, so as you move down the chart, your tax credits go up. The amount of tax credits that you receive go up. And so the lower you will pay for healthcare coverage. So we've had a number of clients over the years that have learned about this, worked with their financial advisor, and they've actually reduced their income much, much lower. But you do have to have some income. Okay, so if you're over here in the 100% or 130, 138%, let's just say you're retired, you have no income. In many cases, you have to create some income. So it has to be between kind of these numbers and 400% of the FPL to do that. Now, we don't have a lot of questions going on right now in the chat. Please feel free to type them in. We're only 20 minutes in or so. So we've got plenty of time. But I want to actually show you a real life case study of how healthcare premium tax credits work and how they're going to be applied to a particular situation. So, Conrad, it's a great question. So if it is non-taxable income, then it would not count toward your modified adjusted gross income. So if you are taking distributions from an account that is post-tax, that has already been taxed, that would not count toward your modified adjusted gross income. So a lot of people are doing these conversions. They have big investment accounts, they're doing these conversions, and they're saying, hey, we have 3 years to live before we get to Medicare. Not 3 years to live, excuse me, the bad example. We have 3 years until we get to Medicare. Let's just say we're 62. And you have 62, 63, and 64. Okay, so you got 3 years. Because at Medicare age, you can't use the tax credits. It's not for Medicare eligible people. What they would do is they would take some money, set aside some money, maybe make a Roth conversion, have a taxable event. Maybe they set aside $300,000. And then they live off that $100,000 a year for 62, 63, and 64. And it's non-taxable, not counting toward their modified adjusted gross income. That would count, that would create an ability for that particular couple or whatever to get advanced premium tax credits at a pretty high level. And so we're working with advisors to be able to do that. I see another question here in Q&A. Thank you. When you say household, what if you have a 23 or 24-year-old that lives with you, but they're not in school? Does their income count? Great question. It's based on how you file your taxes. So if you're claiming them as a dependent and they have income and they're filing a return, then yes, their income would count. However, if they're not a part of your household, they file your own tax return, you're not claiming them as a dependent, they just live in your basement, then they're not a part of your household. So you'd be a household of two. It's all based on how you actually file your return. Next question. How is the household size determined when a divorce is involved? Specifically, ex-husband pays more than 50% of the child's living expenses, but the ex-wife recognizes the child as an exemption, or I'm assuming you mean dependent on the tax return. Well, again, it's all based on how you file the return. Okay, if alimony or child support or whatever is taxable, then you would have to count that. Or if there's some other arrangement that you have and it's taxable, you would have to count that. But a divorced couple can't be filing for premium credits together because they're not married. They're not filing a tax return together. So it's all based on how you file your return, and it doesn't have anything to do with previous years. It all matters in the year that you're going to be actually taking advantage of the premium tax credit. So these are great questions. Keep them coming. We'll be around. So here's an example. We're going to go down to Nashville, Tennessee. I'm from Tennessee originally. Grew up there. Came to Indiana when I was 20 years old. I've been here 20 years. If you could do the math, yes, I'm over 40. But I've been here for a while. But this is an example from Nashville, Tennessee, and it's an early retiree couple, like I was mentioning a moment ago. 62-year-old male, 62-year-old female. They're married. And in this particular example, we've started with their income at $250,000. Why did I do that? Well, I just did that because it's more than 84. Okay. It doesn't matter. It could be 250, 350, 5 million, 2 million. It doesn't matter. It's just more than 84. If that's the case, then this is actually the average cost of what they would pay for an Affordable Care Act compliant plan if they were going to make the transition. Okay. So a bronze level plan in their particular area, these are real numbers. The average cost is $1,900. The silver level plans, the average cost is $2,400. So in this particular scenario, you do the math of a silver level plan times 12, it's $29,556 a year for healthcare coverage. Real interesting, right? Well, if this particular couple understood, worked with their financial advisor and understood what it meant to take advantage of the advanced premium tax credits, then look at what happens if they were able to manage their income down just to the top end of the threshold, $84,000 in modified adjusted gross income. That unlocks $1,900 a month in an APTC, Advanced Premium Tax Credit, and they could enroll in the coverage, whatever it is, Blue Cross Blue Shield of Tennessee, Ambetter, United Healthcare, Cigna, Aetna, whatever company offered the plan that works for them, and they literally would pay $500 a month for that same plan. The same plan that was $30,000 now becomes $6,000. So just by managing modified adjusted gross income, it's unlocked $23,000 in a tax credit to pay for the Affordable Care Act Marketplace plan. Unbelievable, right? Most people have no idea that this exists. And it's been going on for like 12 years. It's not new. It's been going on for a long, long time, but people don't know how to leverage it and take advantage of it. So at Move Health, we teach financial advisors how to take advantage of it, manage income, and then unlock this transition for clients that are in this particular window. Joe, I see a question out there for you. This is in the Q&A box. Does the modified adjusted gross income estimate for the coverage year need to align with the calendar year? If not, how does the first ACA year MAGI get evaluated with your taxes? I'm thinking about the situation retiring mid-year and having MAGI above 400% for that particular year. Joe, you're tracking. This is really good. So it's August, right? August 20th. This is a live webinar, right? So it's August 20th. If a client said, hey, I want to quit my job today, we are looking at modified adjusted gross income for 26. So if they were working a job and they were making $200,000 a year, well, that is, whatever, $18,000 a month. And they've worked for January, February, March, April, May, June, July, August. We'd have to take whatever, 18 grand a month, multiply that by 8 months, and then that would be their modified adjusted gross income up to this point. And then September, October, November, December would be the balance for this year. So it's based on the current tax year. Advanced premium tax credits and advanced premium tax credit eligibility is based on current tax year. Every fall from November 1 through December the 15th, you make an estimate for the following year. So what that particular person could do is they could say, hey, in 2026, I'm not going to get a credit. So I'm probably going to pay whatever it is, $2,000 a month. I'm going to do that for 4 months, September, October, November, December. But in 2027, I can actually get my income down to 84 grand or maybe even lower. So Joe, this is kind of applicable to your question. So we would be doing the estimate or the income for the current tax year, and then you would pick a new plan for 2027. So tax credits go on the tax credit year, January 1 through December 31st. So that happens a lot of times. Sometimes people will pay the higher premium for a few months, and then in the next tax year, they can qualify and it can, change their plan by, $20,000 a year. So that happens often. So I hope that answers your question, Joe. If you want another clarification, just put another clarification in there. Somebody says, hey, where can we see if a doctor is in the ACA network? Great question. So most of the time, there's over 80 plans available in every state. And so what we do as licensed agents and certified on the federal marketplace to do the advanced premium tax credits ACA compliant plans, we actually take you through a process where we gather all of your doctors, gather the specialists, gather the hospitals, and we give you that data through our platform and through the analysis that we have one-on-one, where we would say, Dr. 1 is in, Dr. 2 is in, Dr. 3 is not, Dr. 4 is in, Dr. 5, and you're check, and checking off boxes. So we do that, and it's different for every carrier. So it takes a little time. We have tools that make it easier for us, but in most cases, doctor networks, there's over 80 plans in every particular state, sometimes more, and so we have to do that on a plan by plan basis. So great question. Network's important. Uh, Another question from maybe the same person, I'm not sure. It says anonymous. Divorced and new marriage, 2 kids split, claim each household gets one. Retired, so we'll draw from savings for 3 years because 63-year-old couple, rental income, is that a part of the income? Great question. So modified adjusted gross income, when you think about it, if you take away modified, it's the same thing as AGI. The only difference in modified is you have to add in Social Security income and foreign income if you have it. So if they have rental properties and the rental properties are profitable and it's positively contributing to AGI, then that would be included. But if they have rental properties that bring in $20,000 a month in rental income, but they have to pay a contractor and an HVAC company and a service company and a management company, and they're only profiting $5,000 a month, then the net AGI would be 60 grand a year. Right? So it's just the same thing from a tax perspective. It's all about taxes, and it's all about AGI from a tax perspective. Modified just adds in Social Security and foreign. Great question, though. I'm loving these questions. Keep them going, please. So in this particular situation, you can see the power of the advanced premium tax credits. And this is what we're not talking about dollars here or there. We're talking about over $20,000 a year in this scenario. Some states it's even more. This is just Tennessee. Some states, the tax credits can get up in the $30,000 to $40,000 range. It's unbelievable. And most people have no idea that this exists. In order to do it, you have to quit your job, have no employer coverage, and you have to not be eligible for Medicare and keep your modified adjusted gross income in those windows. Doesn't matter what your assets is. You get 2 million, 3 million, 5 million, 10 million. It doesn't matter. Robin, great question. Why do gold plans look cheaper than silver? So in this particular state, in this particular scenario that I ran in this zip code, the gold plan is showing actually about the same price, or actually even a little bit less than a silver. This is a scenario that I don't know how much time we have left, Josie, but there's something called silver loading, where silver plans actually can be a little bit higher than gold plans in particular areas. And that's what happens here in Tennessee. It's not the same in every state, but just in this particular scenario, this is a scenario where silver plans are actually more than gold. Great question. So I'm just going to mark that one as answered. Thank you, Robin. Another question. Somebody says, who pays Move for advice? So clients do not pay us. Our services are no cost to clients. Financial advisors do pay a subscription fee to be on our platform, but not clients. So we have the Move Health platform. It's built for financial advisors and clients. Financial advisors pay to be on the platform, but clients do not. So they're not paying for interactions with us. We provide our guidance. We have licensed agents, certified agents. They're all salaried W-2 employees of Move, and you would end up working with if you're a client, you would end up working with one of our licensed agents. Great question. Somebody says, hey, I searched for some doctors on the Virginia site, and it seemed like the searches didn't work correctly. Do you find that to be the case with some of these states? So great question. If you're looking just on the marketplace and you're typing in some names on the marketplace, that may not be a sufficient way to do it. A lot of times we have to go to directly to the carrier tools. Oftentimes we're having to go directly to the network. We're having to go maybe download a PDF of it or go to their specific network tool, make sure they're using the specific network to work through that doctor. So some of the tools are kind of finicky, and they're difficult to work with. And so because our team is doing it every single day, they know exactly what is needed to do to double check and confirm doctors are going to be in network. Great. Next comment. It says, I am, this is in the Q&A section, so we're doing really good here. I am 65, or I'm over 65. I am on Medicare, but I'm still working. My wife is 62 and just retired. I'd like to quit when she turns 64, and will need to get her from 64 to Medicare. She does some consulting, and I'm making money too, a little bit over 100,000 gross. Do you have an example? So yes, I would love to. Actually, whoever typed that in, if you wanted to put a zip code in there, I may be able to do a little something special for this particular session, and I could just pull up some numbers, specifically for that area. So in that scenario, if you're in that scenario, if you're a household of 2 and you're making above 84.6, You wouldn't be able to leverage advanced premium tax credits. And I see the zip. I'll plug that in just a second. You wouldn't be able to leverage premium credits if you're above 84.6. So I can just show you exactly what that cost might be and make it. And I'll do that before we get off. So I'll leave it there. Thank you very much. Last question. I'm going to go to the key learning number 3. Michael in the note says, any chance that the laws will change back to help more clients for more client benefits like 2025? So great question, Michael. I don't know if they're still contemplating any type of enhanced premium credits like we had from 21 to 25. I don't know that that's being contemplated at the moment. They were, and it was a pretty hot topic, and they were kind of back and forth. And if you want some interesting things to research and figure out later on, this was one of the central key points of the government shutdown in the fall of 2025 was advanced premium tax credits. Democrats wanted to open up enhanced premium tax credits and make them available for everybody, even the most highest income earning people above this threshold. And generally, Republicans wanted to go back to the 400% of the FPL, which is kind of ironic because really, who benefits mostly from the higher premium tax credits or the enhanced premium tax credits? Those with the highest income. So the Democrats were wanting to help the highest income people, and the Republicans were wanting to go back to the original threshold, which is 400% of the FPL. That was one of the central points of the government shutdown. So it's kind of interesting. I don't believe that they're contemplating doing enhanced credits right now. It could happen. I mean, I don't know. Administrations change. People come up with different things all the time. It could, but even going back to these 400% of the FPL thresholds, still the vast majority of people fall below the threshold, and the vast majority of people still get premium credits. And people like you all that are retiring and being smart and working with advisors and figuring out how to do it, they're leveraging credits at a pretty high amounts. So, all right. So let me get into some of the timelines here. So this is key learning number 3. Okay. So there's some timelines and some action items. If you want to take advantage of this and you want to know how to get advanced premium tax credits and leverage it, how do you do it? Well, you can stop working at any time and have a special enrollment period. So if you lose employer coverage, that would give you an SEP or a special enrollment period, and you could sign up for healthcare coverage. Generally, most people actually sign up during open enrollment. So that's every fall from November 1 through December the 15th. That's when you can generally, enroll in healthcare, through the Affordable Care Act marketplace and leverage the advanced premium tax credits. If you're doing it in the enrollment period, that would be for the future 2027, enrollment timeline. So, who should review their coverage during open enrollment? Well, everybody. If you're a pre-65 small business owner, if you just buy your own healthcare coverage, you need to talk to somebody between November 1 and December the 15th. If you're on COBRA today and you want to figure out if you've got a different option, you want to do it from November 1 through December 15th. If you have had some changes, if your health has changed, you moved, you have some income changes, you should review your coverage between November 1 and December 15th. If you're on a other plan and you want to look and see if you can get a health savings account qualified plan, you should do it between November 1 and December 15th. So anybody that's looking to make some changes and optimize the coverage that they have, you should do it between November 1 and December 15th. And especially if you want to take advantage of advanced premium tax credits, you should do it between November 1 and December the 15th. So what are my next steps? So next steps, and I'm gonna wrap this up and then I'm gonna get to the questions because I have some really, really great ones in there. What are my next steps? Well, if you're, interested in working with us, you can have your financial advisor go to movehealth.io and they can initiate a relationship with us. They can start utilizing our platform. They can initiate a health planning analysis with us where we take your information like providers, doctors, drugs, anything like that, and figure out how we can help you, what recommendations we have, and give you an analysis for your healthcare coverage in this retirement window. So you can have your advisor go to movehealth.io. You can go to movehealth.io and initiate, an engagement with us. So here's the Q&A box. It's 12:38 Central Time. We're doing really, really good. I want to go because I've got like 4 or 5 really, really good ones, and I just want to make sure that we get to these. So the question was, any chance that the credits are going to come back? Enhanced credits are going to come back? I don't know. Not right now. They're not. Nobody that I know of is talking about it. Another question says, have you heard any discussions about getting rid of the premium tax credits altogether? I want to be super clear on this one. The answer is no. I've never heard either side, Republican or Democrat, talking about getting rid of the advanced premium tax credit. There's people who make comments or talk or anything like that, but there's never been any legs or momentum about doing away with premium tax credits. If you'll recall, Obama was elected president in November of 2008. He took office in January of 2009, passed the Affordable Care Act March 23rd, 2010. The marketplace came into play January 1, 2014. Tax credits started January 1, 2014. So we have 14, 15, 16, Trump's president, 17, 18. It actually got better during that time period. We got more carriers to come in, 19, 20, 21, 22, 23, 24, 25, 20. We're like 12, 13, 14 years into this. And nobody, three different administrations, nobody's ever talked about doing away with credits. So I think the credits are here to stay. The way the government giving money, but there's obviously been different viewpoints and different things of how it could be facilitated a little bit better. But right now, and it's literally hundreds of millions of dollars every month that goes out, from the government in the tax credits that pay for individual healthcare coverage. So it's a really, really interesting thing. Next question is confused about the get money way down. Household of three in this zip code. Physician just retired in May, so I got full price bronze plan. We'll need to pull from savings in October. We'll have rental income. So next year, what do we do? Well, if it's a household of three, so then we'll go back here. Household of three. If you want to leverage credits, then a household of three would have to be less than $106,000 in modified adjusted gross income. I don't know the age. It doesn't say the age, but I'm just going to assume, let's just say they're 62 and they have 3 years to get to Medicare. Well, what I've seen in many cases is I've seen financial advisors take, situations like this and actually have income that is created by doing a Roth conversion, creating a pile of cash that is taxed in 26, and they're living off the cash in 27, 28, 29. So call it $500,000 or whatever it might be, taxed in 26, and then they can pull from those savings in 27, 28, 29 to keep income down. That might unlock $20,000 plus in advanced premium tax credits. So great question. Conrad, can you work with Move if we manage our own finances without an advisor? Yes, you can. Go to movehealth.io and you can start an engagement with us there. I will say the vast majority of clients we work with come to us from a financial advisor. So another great questions here. Do credits increase as you move down the federal poverty level chart? Yeah, absolutely. If you'll remember when I was showing this chart, the lower you go, the more the credit increases. So it's really, really interesting and something that a lot of people again don't realize that and need to take advantage of it. So for the situation that we were asking here, I got a zip code. And what I'm going to do, and just for today, I've never done this before. What I'm going to do is actually pull up one of our systems here. Give me just a second, and I'm going to bring it over into this window, and then we're going to run a live number here for this particular person that was interested in cost in that particular area. Okay. So keep your questions coming, by the way, if you want to keep them coming in the Q&A. But the question was, I'm still working. I'm Medicare eligible. My wife is 62 and just retired. So what I'm getting ready to do is I'm just going to go to this particular zip code that this person provided, and I'm going to pull just an individual price for the person that's 62. So give me just a second, and I'm going to bring that into the screen here, and you're going to be able to see it. It's super simple and super easy. So here we go. All right. All right, this person told me that the zip code is 35226. Okay. This person told me that their wife is 62, so female. So be a single, right? And we're looking, and they're going to be making over 100,000. So if you go back to the chart here, can they get a credit? Yes or no? Household of two, 100,000. The answer would be no, because 84,000 is the threshold. So if we look at this, 35662. In this particular area, there are 54 plans. Okay, 54 plans, all from 4 different insurance companies: Ambetter of Alabama, Blue Cross of Alabama, Oscar, and United Healthcare. Okay, so they're ranked into categories. There's gold, silver, and bronze. It is showing right now, it's showing just the bronze level plans. So for this particular person, 62 years old, wife, plans would start at almost $1,000 a month. If we go into silver level plans, they're bumping up here to 14. 100, 1,500 or more. And if we wanted to go to gold level plans in Alabama, you're going to see gold level plans are at, 15, 16, 1,700 bucks a month. Now, how could this be different? Well, in this particular scenario, even though if we had the husband, let's say the husband is 67 and the husband is Medicare eligible, right? So we're not going to be using that person. So we still make them a household of two. And if their income was 84,000, they would get a premium credit of $770 a month in the same exact scenario here. And they could take that premium credit of $770 a month and apply it to whatever plan they wanted to apply it to. This is a household of two at 80,000. This may not be possible for this particular scenario because I think in the scenario they said they want to quit working. There's, the wife is doing some consulting. They would have income over 100,000. Here's an example. So in this particular scenario, this person, if they're going to be 100,000, then they would get no credit and they would just have to pay the full price of an Affordable Care Act compliant plan. So we would start looking at some of the other options. We would say, hey, are there other options? Can we look at, short-term medical? Should we look at a healthcare sharing program? Or should we just go on Affordable Care Act plans and just pay the full price? That is an example of what we do, here at Move Health. So I'm looking here. Josie, if you see any other questions in the, I see one. This person says, I'm single, work as needed, PRN, and so it's very hard to determine modified adjusted gross income. Can you suggest ways that I can lower my modified adjusted gross income? Well, it's a great question. One way would be to work less. I suppose that would be one way. There also are ways. You can reduce your modified adjusted gross income by giving. Give to churches or nonprofit organizations. You can create open a health savings account and make a contribution to a health savings account, and that would reduce your modified adjusted gross income. If you just have income that you can't control, there are ways. It would just be things that you can do to reduce your taxable income. But the number one way is to not work as much, and that way your income wouldn't be as high. So really, really good. So another question here: do they, I already answered that one. Do the credits increase? Did you go down? Yes. So this would be good. I'll just answer this one live with an actual scenario here. So if we go back to this scenario, if you remember, I put in $84,000, and that gave a credit of $770. What if I put in $60,000? The credit goes up to $944. What if I put in $40,000? The credit goes up to $1,265. So yes, this is not a typo. You can have a premium credit that is more than the cost of the plan, netting the cost of the healthcare plan to be zero. This is real, not a typo. And this is live. You can do that. So the credit, as your income goes down, okay, you get more credits. The deductibles go down, stuff like that. Lots of stuff happens. But you can also get to the point where your credit is actually more than what you pay for a plan. Really, really interesting stuff. Most people have no idea. So other great questions here. Do ACA plans coordinate with CHIPS programs? I'm assuming CHIPS, you're talking about kids, like children's health insurance programs. Yes, so that is common. Sometimes we have parents and kids on Medicaid and adults on Affordable Care Act plans. That happens a lot. What about an HSA? Any specifics to be worthwhile? A 63-year-old couple could do a Roth conversion to get money, for a few years to Medicare otherwise. Yes, love HSAs. In fact, one of the things in the One Big Beautiful Bill was that every bronze plan is now HSA eligible. So if you see it, you're looking at it, and it has a bronze on it, it's HSA eligible. It doesn't have to have HSA in the name. It just needs to be a bronze plan, Affordable Care Act compliant, and it's HSA eligible. It's a great way to reduce down. A lot of times people are like, hey, my income is 90,000. Like, okay, why is your income 90,000? Well, I don't know, because this, and this. Can you make a $5,000 donation to your church and put $5,000 in an HSA? All of a sudden, you unlock 10 grand in tax credits, or 9,600, 800 times 12. right? So it makes a massive difference. You just have to know and understand the rules and figure out how to navigate it. So got that one. And then last, I have heard that premiums for the ACA plans are sometimes going up a lot more than other plans. Is that true? Is it hard to decide? Oh, it's hard to decide to retire early if that's possible. Well, great question. We have watched and witnessed the cost of Affordable Care Act compliant plans go up and down. Dependent upon the year, dependent upon the state, dependent upon multiple factors. So what's interesting is if you're taking advantage of the advanced premium tax credits, most people don't feel those increases because the tax credits go up to offset the advanced premium credits. If you'll notice from this particular chart, if you're at or below 400% of the FPL, there's a limit to the percentage of your household income that you can actually pay for health insurance coverage. It's a affordability factor that the government created 12, 13 years ago. And so, if the plan is, whatever, if the plan is $2,000 a month, but you're getting an advanced premium tax credit because you're under the 400% of the FPL threshold, you don't really feel it because you're not seeing that. You're not paying the full premium. Sure, you might pay a little bit more, you might pay whatever, but relative to what you are paying on an annual basis, the rate increases have been less impactful to those that are eligible for tax credits. But I'll answer it candidly. Yes, the cost of healthcare insurance has went up virtually every single year. But if you're leveraging the advanced premium tax credits, you're a little bit, you're a little bit sheltered from that. So we really appreciate the time and the attention to detail, the questions, everything that we've had. Again, we invite you to go to movehealth.io to visit us. That's our website, movehealth.io. If you're a financial advisor, we invite you to check out our platform. If you're a client, we'd love to engage with you. My name is Drew Shockley. I'm one of the founders of Move Health. I've been in this industry for 20 years. I love it. This was a great group with some great questions. If you would love to contact us, we invite you to go to movehealth.io. And if you're individual and you have a financial advisor and they're not talking about Move Health, introduce them to us. Send them a note. Let them connect with us, and we'd be glad to help. Thank you for taking your time today. I hope you have a great rest of your day this Thursday, and we will catch you all again very, very, very soon. Josie, I agree. 5 stars to this group. Really, really good. High reviews. Thanks, everybody. We appreciate you. Hope you have a good rest of your day, and we will talk to you again soon. Thanks. Bye-bye.